Hey, friends, welcome to Dr. AJ Vibes. Good morning, good afternoon, good evening, wherever you are watching from. So, we have been discussing about miasms since last week, right? Miasm is a Greek Latin word for body nature, bodily tendencies, a deep rooted affiliation of our body, right? So we took a look at Sora last week. Sora is functional disturbances within us and under function of our organ systems, functional systems. They are functioning at a lower level than normal level, right? In Sora. So let's go into another miasm today called psychosis. So psychotic miasm, what is it means? It represents excess of everything. It is called miasm of excess, right? A chronic reaction mode where our body is producing excessive reaction, excessive happening, right? Proliferation, that sort of stuff. So psychosis. The psychotic miasm is defined by excess of everything, overgrowth. It presents physically with tissue proliferation. Tissue is proliferating, right? Such as you can see the warts on body surfaces. Many people we get to see they have warts, right? Tumors, for example, excessive growth again. Condylomata, that's genital warts, right? Warts around genital organs. Polyps, moles, fibroids. Most common, maybe you heard uterine fibroids, common in a woman, bit later in the life, pre-menopausal age, that sort of time, or bit earlier as well. So they develop uterine fibroids. But there are many sorts of fibroids can take place in our body. Often stemming from suppressed discharges, right? Whatever discharges, nozzle discharges, suppressed, there could be nozzle polyps, right? Polyps inside nozzle cavities, right? Uterine discharges being suppressed. In the female, they developed uterine fibroids, polyps, that's of growthy structures, right? So due to suppressed discharges, right, excessively a sweating person, whatever reason, probably sweat has been suppressed, they don't sweat that much anymore, but now they are developing the growthy structures, the warts, very common known growth on skin, warts, right? They may be developing that sort of stuff. Thickening of skin and nails being thickened and brittle, right? They easily fragment. You can see over the nails, you can observe that for some people, right? Maybe one of your family members or friends, they may have it, right? So thickening of dermal tissue, skin and nails. Stiff joints, again, such a sort of rheumatic changes. Joints have been thickened inside the joint capsule, your knee joint, your wrist joint, your elbow joint, could be anywhere, right? Joints, they are stiffening rheumatic pains they are producing, ankles, heels, these are common places, right? Now this comes under psychotic tendency, the miasm, right? The last week it was psoric tendency, psoric miasm. Now we are taking a look at psychotic miasm, the changes that happen due to psychotic bodily changes, right? They retain fluids, develop obesity, right? Infiltration in the joints, right? Discharges, chronic thick yellow green mucus. It could be nostril discharge or any other discharges, and urinary infections with the discharges could be, right? And uterine vaginal discharges in female. So they are chronic thick yellow green mucus, right? So as I just said, genitals or nostril discharges, excessive production of mucus. So lots of production of mucus happens in the throat, nose, you have to clear constantly all the time. Now it is definitely psychotic tendency, psychotic miasm. So why do we need to know this, all this? As a people, regular people, I mean, if you need to take help from a homeopath, as we often say, you have to be aware of these sort of things. When you are aware, then when your homeopath, a doctor probes at you, asks you various questions, you will easily recollect because it is on your mind. You have this awareness already. Hey, maybe doc might be looking at psychotic miasm or psoric miasm, right? It looks like I have this tendency, and we will be able to recollect, and the better we do our job informing the practitioner, the far better they will be able to help us. So we are looking at psychotic miasm, right? A bodily tendency. It is called miasm of excess. Everything excessive, unlike sora, other miasm which is under functioning, functional disturbance and under functioning. This one is excessive functioning, excessive happening, right? In every organ system, skin or mucosa, right? It is producing excessive discharges, everything excess here, right? Infections, one of the common things we see in psychotic tendency, for example, ENT infections, because discharges, we just mentioned discharges, right? So ear, nose, throat, discharges, ENT, urinary tract, we mentioned already, urinary tract infections, chronic pyogenic, means there is often a formation of pus in their pustules. So pyogenic, for example, sinusitis, right? Sinus infections, very common, right? We see lots of our family members, friends may be suffering with sinus problems, right? In the winter season, in the rainy season, when cold weather, people are developing sinuses, right? Homeopathy is one of the best with all these conditions, believe me, right? So asthma, it may go little deeper into your respiratory system and is creating asthmatic, allergic, asthmatic tendencies. Homeopathy is excellent again for these sort of issues. I have dealt with many cases in my clinical practice, right? So Sycosis barbae, and you are having, at a barber shop, maybe in India, right? Because here in where I live, they don't go and do beard or shaving, that sort of, they don't do much here. I don't know why. Maybe same for infection control reasons. But in India it is quite common, right? They do shaving as well. So psychosis barbe, so it happens your skin is having kind of developing infection, it is having pustules, right? That sort of condition. Now that is the psychotic miasm. It's not psoric. Usually in psoric miasm we see skin rashes and itch. Remember itchy disease in psora. But here it is slightly pyogenic. It's a chronic, easily infection takes place in psychotic miasm, and it produces pus, the sort of stuff. So sinusitis, asthma, psychosis barbe, right? Some of the examples I was reflecting upon earlier. Metabolic diseases that comes under psychotic miasm. Most common diabetes, right? And Bright's disease with diabetes and hypertension and several other reasons, your kidney starts affecting. Bright's disease, right? Proteinuria, it is producing protein. Maybe you heard this happens, right? Proteinuria, albuminuria, edema of feet, swelling in the feet and ankle joints, maybe legs slowly starting swelling up, right? Excessive blood pressure along with diabetes. Now these are the symptoms in Bright's disease, right? Now this comes under psychotic tendencies, psychotic miasm. Okay, my friends, again, this is not for you to self-diagnose. This is only information and awareness purposes only, and as well as you get to know the scope of homeopathy, where homeopathy can help, right? And when you go and see your practitioner, you will be able to recollect this sort of stuff if we have, and present well to your practitioner, your homeopathic doctor, so that they can help you best way possible, right? Mental and emotional sphere in psychotic miasm. Let's have a look at fixed ideas. People have fixed ideas in psychosis, right? Slow in comprehension. They are little slow, okay? Things happen, so a bit slow sometimes, right? And suspicious. So they are secretive, hide things, insecure. They are not feeling so secure or whatever reason, right? So they hide things from you. Okay, could be a family member, a bit secretive personality. Okay, so alternating moods. They alternate very fast, very quickly from one mood to another mood. Moody condition, or we saw that in psoric as well, right? So it's borderline, psora to psychotic, right? So there are psychotic features here with moodiness, right? And it's alternating moody or anxiety or confusion, sometimes very anxious, hyperactive, sometimes confusion takes over. So they are a bit moody and bit low, right? They are alternating moods, hypersensitive to criticism. Maybe you have seen this, right? So if you do a small, minute thing, you may say something, it's a big deal. They take it very serious. They can't tolerate criticism. Now that is the emotional sphere of psychotic miasm. You can see the scope of homeopathy where it can help with these sort of issues, right? So driven by compulsions. They have to do this, they have to do that. They are always driven, they are compulsions. You can't help them. They have to do pretty harmless, but they have to do, they are driven by compulsive nature. They have to say some things, or they have to do some things, they have to act a certain way. That compulsive behavior, because they have, remember, fixed ideas in my mind. Fixed ideas. You can't change them. They are there. You have to stick to those ideas. Right? That's a psychotic miasm. So before we end this psychotic miasm, just to give just some idea, we are not going to too deep inside these miasms, but if we have understanding of these miasms, sora, psychosis, next week we will have a look at another miasm, syphilis. Okay, so just some idea, having this idea in your awareness. This is homeopathic awareness videos, right? That's what we are doing. So having this awareness, when you consult your homeopath and they are probing questions at you, you understand, oh, okay, this is what he is looking at, she is looking at, and you will easily recollect and try to cooperate with your practitioner so that they will be able to help you best possible way. So before we wind up, key characteristics, let's look at just a few very important key characteristics of overall this condition called psychotic miasm. Suppression of discharges, we discussed it in the very early stage of today's talk, right? Suppression of discharges with antibiotics for infections, or could be anything. Some you are suppressing discharge, you are suppressing. The discharge could be sweat, or nozzle discharges, or oral discharges, or discharges from your eyes, any organs, discharge coming from your ears. We suppressed it instead of addressing it, we suppressed it, right? Female discharges, uterine discharges, right? All these sort of suppressions leading to growth, excessive growth, polyps, nasal polyps, fibroids, uterine fibroids, could be internal gastric system, within respiratory system. Wherever there is some excessive growth preceded by a history of suppressed discharges, right? Now that is one of the key characteristics of psychotic miasm. Slow development, we mentioned, we touched base upon it little earlier, right? Slow development, little slow. Things go slow for the psychotic miasm, slow moving, but they are persistent. Okay? They don't give up easily. They don't give up. They persist. They are slow. They are moving along the journey slowly, but they persist. Now that is one of the excellent, important feature of psychotic miasm. Okay? Worse always, because all these discharges and that sort of stuff, right? Phlegm, all these things, they increase, aggravate in cold weather, cold, damp weather, near sea, like me. We live just around the, not far away from ocean, on the coastal region, right? So, so these are some of the key characteristics to remember psychotic tendency, psychotic miasm, if our body have that sort of nature. Okay? History of gonorrhea. Actually, psychosis, in the early stages, they found it. Hahnemann, the founder of homeopathic system, 16th, 17th century, those days, early days, they found there is usually the history of gonorrhea, and gonorrhea being suppressed. So there is a discharge in gonorrhea, right? Now again, that discharge being suppressed, and following all these excessive growth, proliferation, that sort of various sort of conditions, diseases related to that, right? Now let me give you just a few names of medications, homeopathic remedies, homeopathy medicines that cover psychotic miasm. There are dozens and dozens and dozens of them. These are just example to give you one of the best psychotic, mostly maybe you heard, this is very common public knowledge, is Tuja for warts, right? Warts. I put my hand like this because I used to have lots of warts in my student days, 35, 40 years ago. Lots of them. They are gone with just a single dose of homeopathic medicine, right? I will get to that sometime. No problem. What helped me? My principal back then, my professor, I went to see and I showed my hand. He said, okay, let him get one dose of this. That's it. They all disappeared. Just like the next day morning, there was not even a scar. I can show in my old photographs, right? They are so clear. They used to be just with one dose of homeopathic antipsychotic medication, and it's gone. Okay? So, but that happens. Tuja is one of the best examples. By the way, Tuja was not the medicine given to me, but Tuja is most common. If you say warts in homeopathy, lots of people, it's a public knowledge, it's a Tuja, occidentalis Tuja, right? Then Medorinum, one of the nosodes, Medorinum is a antipsychotic, okay? Natron sulfur, excessive discharges from cold weather, damp weather, we discussed it. We will go into lots of medicines, homeopathics. We will discuss, right, what sort of features indicate that particular medicine. Again, this is for improve the awareness of homeopathy among my friends who happen to see my all other sort of videos, inspirational videos I do, right? So my friends, whoever being attracted to my channel with my background, homeopathic physician, so I want to bring this awareness and let everyone know the scope of homeopathy. So I will go into Medica, I will go into drugs, I will go into repertory, I will go into philosophy, I will go into therapeutics, various subjects, internal medicine and therapeutics. Now then we will discuss in a very simple way, easy way, so that everybody, you don't have to be a doctor or a medical professional. The whole idea is for you to develop some awareness as a general population. Then when you have to consult a homeopathic physician, and because of this awareness, because you are an equally important person in homeopathy to get the best possible result besides your treating doctor. You play a big role in homeopathy because you have to relate all these symptoms and bodily natures, tendencies, what happens to you, you have to relate it to your practitioner, right? So this information helps a lot. That's my feeling. So we will do these videos, keep on doing. So these are some of the medicines: Tuja, Medorinum, Natron sulf, Pulsatilla, then dozens and dozens, just some examples. Okay, my friends. So psychosis is what? A miasm of excess. Excessive growths, excessive discharges, excessive functioning, hyperactivity, hyperfunctioning of systems, endocrinal system, respiratory system, digestive system, UTI, urinary tract, urinary system, anything, right? So it's a miasm of excess and chronic reaction mode. We call them miasms or chronic reactions mode. Here in Sora, it is underfunction, functional, underfunction. And the next miasm, this is psychotic. Here it jumps into excessive side. Okay, my friends, I don't want to go too deep into this topic, but I'm sure you developed some idea about psychotic miasm and how homeopathy helps. If you have these tendencies and you relate this with your physician, and you will be helped far better way. Okay, my friends, tier ones, please subscribe to this channel. Okay, I need your support to do these videos, do my work and present in these videos, right? Then I do inspirational videos 2 days a week, just to inspire my friends. I like to be inspired myself. I'm that sort of person, right? So what I enjoy, I want to give it to my friends here, you and everyone, our community here. Okay, so I do inspirational, various sort of inspirational videos. In future I will be going on to various places around this country or maybe some other countries. I might be traveling, right? We'll bring everything on this channel. You let to see whatever we are doing. Okay, then I will bring this homeopathic educational awareness videos. So please support me. Subscribe to this channel. Subscription is very easy, right? Some of the friends were asking, hey, what should I do to subscribe? Nothing, just click on this video, it opens the channel, right? Dr. Ajay Vibes, that's the channel name, by the way. Dr. Ajay Vibes. That's it. Go to their channel. It says a subscribe button there. Subscribe, it says. Click. You are subscribed. That's simple, right? So that supports channel to grow, channel to stabilize channel, monetize channel. Channel will become permanent in the YouTube world. It's a big world, YouTube world, right? As big as the sky and the stars we see. It's a very big world. So we have to make a footprint on that channel so that we will stay stabilized, and then we will do these awesome videos and help everyone. Very soon I will be doing lives. I will be also doing some videos in Telugu language. My friends, Telugu background, I am Telugu background person. Namaskaram, bagunnara? Telugu, okay? So I will be doing, if you know me already, you know that anyway, but anyone new wondering, hey, what background is this guy? Looks like Indian. What background is he? So I am Telugu background, okay? Telugu person. So I am planning to do Telugu videos as well. Maybe some lives in Telugu and some in English. So I have to do both because I have friends from all around the world in this country where I live, in Australia and USA and Europe, and of course many other states in India, non-Telugu speaking states, right? I mostly connect with them either in English or a little bit of Hindi, I know, right? So but anyway friends, please subscribe to this channel, and we will see again on an inspiration video early next week. Up until then, enjoy your weekend. Bye for now.